Welcome to Practical Cardiology Pearls, where complex cardiology is simplified. Today, we'll discuss an ECG case together.
Before we begin, pause the video, analyze the ECG, and try to identify the key finding. Then, we'll review it together step by step.
The first thing I notice on this ECG is the narrow peaked appearance of the T waves. Let's analyze it step by step and determine what this finding represents. In the first step, we can see that each P wave is followed by a QRS complex. The P waves are positive in the inferior leads and negative in lead AVR. The P wave amplitude does not exceed 2.5 millimeters. Next, let's measure the PR interval. The PR interval is measured from the beginning of the P wave to the beginning of the QRS complex. Here, the PR interval is 3 small boxes. Since each small box represents 40 milliseconds, the PR interval is 120 milliseconds, which is within the normal range. Next, let's measure the QRS duration. By drawing two parallel lines through the beginning and the end of the QRS complex, we can see that it spans 2 small boxes, which equals 80 milliseconds. Since the normal QRS duration is between 70 and 100 milliseconds, the QRS duration is normal. Now let's measure the QT interval. The QT interval is measured from the beginning of the QRS complex to the end of the T wave. In this ECG, it measures 7 small boxes. Next, we measure the RR interval, which is 17 small boxes. Using these measurements, we can calculate the corrected QT interval, or QTC. Let's use AI to help us with the calculation and see what result we get. As you can see, we entered the measured QT and RR intervals into an AI tool and asked it to calculate the corrected QTC interval, QTC. The AI calculated a QTC of 339 milliseconds. In general, the normal QTC range is approximately 350 to 450 milliseconds in men and 360 to 460 milliseconds in women, although slight variations may exist between references. Since our patient's QTC is 339 milliseconds, it falls below the normal range, indicating a shortened QT interval. If you identify a shortened QT interval on an ECG, it is important to investigate the underlying cause. The first step is to check for electrolyte abnormalities, particularly potassium, calcium, and magnesium levels, as these can affect the QT interval. Next, review the patient's medications, since certain drugs, such as digoxin, can shorten the QT interval. You should also consider other potential causes, including acidosis, hypothermia, and increased vagal tone. If no secondary cause is identified, an inherited short QT syndrome should be considered, especially in patients with a personal or family history of arrhythmias, syncope, or sudden cardiac death. Are there any other causes of a shortened QT interval that you routinely look for? Let us know in the comments. Thanks for watching. Let me know in the comments which cardiology topic you'd like to see next. If you enjoyed this video, please like, subscribe, and share. See you in the next video.